Hello, everyone. Bruno here, and we are here for our second episode of season 2 of our exocrine gland biology podcast.
Hi, everyone. Here is Juliana, and I'm happy to have you join us today. If you are new to the podcast, this is an initiative from the Exocrine Gland Biology Group to bring interesting discussions with international researchers in the field. If you missed the previous episode, I suggest you to go back there because we had an incredible discussion about salivary gland development, regeneration, and potential treatments via neurosignaling with Professor Kujan Kazi from the University of Yamagata in Japan.
Today, we're here with Juanita Van Steen, invited moderator that will help to lead this episode. Juanita, would you like to introduce yourself?
Yes, thank you so much. Thank you for the invite. I'm very happy to be here. My name is Jonita van Santen. I'm a PhD from the Department of Oral Biochemistry and the Department of Periodontology in the Academic Center for Dentistry in Amsterdam, the Netherlands. And I do my project in collaboration with two other departments at the University Medical Center in Groningen, also in the Netherlands. And my research focuses on identification of salivary biomarkers, specifically ions, electrolytes, for the diagnosis and or screening for Sjogren's disease.
Thank you for being here with us. And as our guest speaker, I'm honored to introduce Dr. Naile Dame Teixeira, who is an associate professor at the University of Brasília, where she leads the Laboratory of Biomateria and Oral Microbiology. Professor Naile is a CNPq Research Fellow, a former Newton International Fellow, and active member of the IADR. Professor Naile has published over 80 scientific articles, supervised more than 30 students, and earned major recognitions, including the IADR Colgate Research in Prevention Award and the IADR Centennial Award for New Investigators. She combines clinical studies, observational work, and systematic reviews to understand salivary flow dynamics in different populations and the oral microbiome.
Today, we will highlight 3 of her recent works. One is the normal salivary flow rate in healthy adults, a systematic review with a meta-analysis published in JDR Clinical Translational Research. Another one that is salivary flow and aging, a cross-sectional estimate of the annual decline per year of age, published in the Oral Journal, and the book of oral microbiome published by Springer. We are excited to have you here, Professor Naile, and I would like to start you asking you to introduce yourself and explain a little bit of your main research focus.
Well, thank you so much, Bruno, Juliana, and Juanita for having me here. It's a pleasure to be with you today. As Juliana said, I'm a faculty member at the University of Brasília since 2017. And here I'm a cardiologist, and I lead the Biomicro Lab and the Cardiology and Oral Microbiology Research Group. Juliana already said that my main focus is to characterize the oral ecosystem, including the oral microbiome, biofilm behavior, salivary parameters, and how caries, with particular focus on root caries and other conditions, shape the ecology of our mouth. My group tried to bring more clinical, population-based, and ecological perspectives to saliva research, especially by linking salivary parameters with caries, aging, hyperglycemia, and the importance, if any, of the low abundance microorganisms within the oral ecosystem. More recently, we have been dedicated some time to map the oral archaea across different oral sites, including some novelty in supragingival biofilms and also in saliva.
That's fascinating, Professor Naile, how you can connect your research subjects, explore different areas, and put them together. Mm-hmm. So what inspired you to start working with saliva research? Was there a particular moment or project or even a finding from your previous work or patient that first sparked you interest in salivary research?
It's really nice to have this question from you. I must say in this podcast that Juliana, when she was during her undergrad at the University of Brasília, she was the first one pipetting saliva in my group. So just want to mention this nice meeting her here in this podcast. So Juliana, I want to say that this all started in 2017 when I arrived at UNB, and I met two dentists who showed me how overlooked saliva still is in the clinical practice. Dr. Daniela Grisi and Fernanda de Paula, who is my current PhD student. They had long-term clinical experience in dry mouth patients and needed a scientist to help them with a randomized clinical trial to produce evidence on treatment for this clinical problem. So through this experience in helping them, I realized how studying central salivary functions to maintain the oral microbiome and its resilience against caries would be inevitable to my research line. Not studying saliva seemed to be like a missing piece of my research. And thanks to them, I added this variable to my research in further studies in the further years. That also triggered my current obsession in producing evidence-based salivary diagnosis and salivary management methods.
I want to comment too that it was very special for me to be your first student in the lab. I remember when you got to the university and I looked at you and I was like, this is a new professor and she's gonna be different. And I was so happy to have you there. So I really wanted to work with you at that time. And it's interesting because I left the saliva area for a little bit and then now I'm back to it. So it connects too. So I started working with other things. I started working with radiation. And then now I work with radiation and saliva. So I also connect two different interests just like you did. And I think it's important also to mention here that dental carie is one of the main problems we have when patients don't have saliva. So if the loss of saliva, or even if saliva is just changing the composition, we can have dental caries as one of the main problems and concerns of the patients. So this research is very important for us to make this connection and know how we can solve the problems. So it's interesting when you say that you were studying dental carie and then you decide that saliva is also very important. So I have to include that in my research. And I want to add a comment and a question here because you have a lot of papers that you are the last author and now you also published a book. So I want you to comment what inspired you to publish this book and what does it mean for you to be the last author of the papers?
Fantastic question, Ju. It's really nice. Well, the book came from a nice motivation, which is friendship. I have my friends, Dr. Tuido from the University of Leeds and Dr. Naile Dame from ACTA, Amsterdam, from Juanita's university. And three of us wanted to put together a team of collaborators and friends we have been doing individually, or the three of us during our careers, to make a nice story on the complexity of the oral microbiome. And this project reflected a global collaboration with perspectives and expertise from researchers from Netherlands, the UK, Brazil, of course, China, Italy, Japan, Germany, Spain, US, and others. And we are so proud of that diversity in our book. And we really like to say that the book was edited by three women to all women in science. And you mentioned many papers there as last author or principal investigator, isn't it? So it means actually for me that I'm coordinating a big team. So this is a super responsibility for me. So since 2017, I supervised not only postgrad, but also undergrad students that published their final year projects. And this is because they learned how to do science and how this can be important to their careers. It represents building capacity, training new generation of scientists, stimulating my students to see another possibility of career through the research, as you, Juliana, and we always use you as our example here. And I also have this as a responsibility to create a research identity within my students and within my team.
Pretty nice to see, and also how life can shift in science. Sometimes it's just like merging different knowledges to put all together. So it's pretty cool. It's amazing.
Yeah. Yeah, I agree. I also think it's really inspiring to hear that you also try to, well, the same that you want for yourself to diverge in your and make it unique your own research to yourself, but then also like allow your students to attain that. That's really admirable. Yeah.
This was
Yes.
something that I learned with my experience until now, that sometimes we have to choose the mentor more than the subject, because when you have a good mentor, you can learn so much and make so many connections that you can get the subject that you're interested in together with something else, but with someone that is mentoring you well, so you can progress.
Yeah, I fully agree.
Okay, going to your papers, you have a systematic review with a meta-analysis comparing standard thresholds values for unstimulated saliva flow and stimulated saliva flow and the values in the contemporary population. Could you comment on what made your group hypothesis that would be a difference between these two values nowadays?
That's a great question, Bruno. The classical thresholds come from mainly from early studies. Today, we know population is getting older, taking more medications, living longer with more chronic disease, and are exposed to different environment factors like smoking, vaping, that all can impact saliva quality and quantity. So the hypothesis was simple. If the population changed, should the reference values change? So we came with this idea of combining all data from different studies globally, focusing not in the disease, but in health. For example, if the study compared a hyposalivation associated condition with a healthy group, we focused on this control healthy group to calculate an average of what could be considered a healthy salivary flow. So based on 63 studies, including more than 3,000 healthy individuals and 2,000 individuals with any hypersalivation associated condition, we found that the average of unstimulated salivary flow in healthy people is much higher than the current parameters to define normality. So it means we could be considering hyposalivation clinically much later than it could be causing any damage. So we also did some meta-regressions and subgroup analysis to test if results were influenced by latitude as a proxy to countries' average temperatures, geographical, cultural characteristics, as well as by study year, methodological quality, and none of these criteria did explain the data variability. So in other meta-analyses, we also calculated the mean difference in salivary flow between individuals with any hyposalivation associated condition versus healthy controls. And it was about 0.4 ml per minute, suggesting that this could be a kind of threshold to be considered clinically relevant reduction of the salivary flow. So this was to estimate what is normal versus what is expected abnormal salivary flow, regardless of the cause of it.
That's really cool. And you mentioned the number of patients and like number of studies that include and something that it always kind of pass through my mind when we're talking about systematic reviews and meta-analysis in dental science, in DOC science, is that the quality and the amount of studies, because when you compare this kind of systematic reviews with, for example, like oncology, the oncology field or cardiology, that they have like clinical trials with 10,000, 20,000 patients, and then we make like a very focused reduction to kind of extrapolate the methods to our studies in DOC. How do you see, like in terms of maturity of this saliva science to come with an outcome and a conclusion like that? So how do you see how mature is the science right now? I know this is a conceptual question. It's not exactly something that we have an answer from the top of our head, but it's more like how do you see the field right now? Are we mature enough to start giving this kind of answer to the population?
I don't think so. I think I'm going to comment this with you later, but I think this is time to discuss scientifically what to do and how can we compare what is healthy, what is not healthy with new data, not only based on previous population with old habits and everything. So it's time for us to discuss, I think.
I have a question about this comparison that you made with controls and saliva-associated conditions. What was this type of conditions that you included?
Oh, it's a lot of them. We just mixed them all together. They could be like diabetes, menopause,
Children?
hypertension, everything.
Okay.
Sjogren, we do have some Sjogren disease in these patients, yes. Yeah, and then we combine them all into one single group, which we called hyposalivation associated conditions. So what we expected to be there is something that could reduce your salivary flow.
Yeah. So if we bring all these different groups to the discussion, we have a lot of like different areas to work together and establish these new values that you're talking about, discuss what is new and what is old standards that we still use as our main standard right now. And I think the only way that we can do this and make the science better is through collaboration. So we need to collaborate with people from other fields and expand that. So as Bruno was saying, the oncologist field, the cardiologist field, they have very big studies. And why we're not including saliva as one of the outcomes in those big studies, because saliva is a problem for so many different groups. So I think I agree with you. That's the time to discuss this and bring people together and increase collaborations.
Yeah, I think maybe to then stay on topic, because you also already mentioned about that we need to start working on how we do salivary research. And I think the topic of saliva collection is always a really big one. It's a global discussion, I believe, right now as well. What is your perspective on this? Like, what do you think we should do to achieve like a standard? Because right now there's so many different methods, right?
Well, Juanita, I think this is a nice question. And I believe the field needs a consensus to truly move science forward. This is fact. But beyond that, if clinicians consistently use a single standardized cyanometry protocol in their own practice, their patients become comparable to themselves over time. So this is different points of view. The clinical point of view that we can start doing immediately in our clinics, and the science point of view to discuss as we are talking about new threshold methods, new treatments, where we can start treating these patients for hyposalivation and things like that, you know. So these are different. And that said, I'm currently serving as a chair of the IADR Science Information Committee. And I'm pleased to share with you today that we are developing an official statement focused on saliva biology and diagnostics. And if this statement is approved through all necessary channels within IADR, we will position IADR to actively support advances in this area by strengthening education and awareness among dental professionals about saliva, promoting integration of evidence-based practice in clinical care, and encouraging interdisciplinary collaboration among academia, clinicians, policymakers, and industry to accelerate translational research. So to make this discussion something that is more related to daily clinical based work, you know. And also, Juanita, in my group, we are currently conducting a scoping review to map how the literature defines and measure all the saliva dysfunctions, looking at diagnostic criteria of dry mouth, stimulation methods, collection times, pre-cielometry instructions like fasting if they need to do that, and for how long. The use of questionnaires or scales for xerostomia, among other aspects. And here, Bruno, more than 3,000 studies were screened, more than 3,000. So poor my girls. Yeah, my students had lots of work to do on this. And one of the findings that we already analyzed and that really got me here was that most studies in the literature have performed cyelometry for longer than 5 minutes. It seems like nothing, but can you imagine 5 minutes of your life collecting saliva for a patient? So it means too much chairside time, unnecessary discomfort to these patients, not feasible in terms of costs for your clinical practice, because this is going to increase your costs, of course. So what we can see from now, from this small results so far, is that shorter alternatives would be much better for everyone, for the clinician and for the patients. This review is almost complete, but we didn't finish yet. We hope to finish very soon, and we are going to bring more ideas of how to do that. But I don't think at this point we do have specific ways to do everywhere, you know.
Yeah, no, I understand, like, but it's amazing to hear what's in the works, and the scoping review, I think, is an amazing addition. Like, this is something that needed investigation, some information that was necessary in the field. It is also shocking to hear that a lot of people do more than 5 minutes. I, on a regular basis, have patients and collect saliva with them, and 5 minutes is really difficult. I really hope that this will lead us toward a consensus and indeed make saliva collection at least like standardized across the world, because it will make for easier comparison between studies as well, of course.
And I think when you talk about the systematic review you did, we can see that we need people to do the same type of analysis, the same time of analysis, and then we can put this together and get better results. And also, as you said in the clinic, for the patients, we don't have a standard right now. Choose the standard you're using in your clinic, so you can compare your patient to your previous exam in the same patient.
I think, Ju, at this point, I don't think we can talk about a cutoff value that should be treated as one size fits all, you know. I think we have to work on something more based on contextualizing patient, as you said, than specifically working to find a specific number that you are going to say this is healthy or not, you know. In our analysis in this systematic review that we published, even using controlled saliva collection methods that Juanita was asking, and restricting age range, removing all studies including children and older adults that we know may have effect in the salivary flow, we still saw some substantial heterogeneity. And as I said, factors like latitude, study year, study quality did not influence salivary flow values. This tells us that variability is not a noise. It's an intrinsic characteristic of salivary physiology. And that's why we echo what Professor Colin Dawes highlighted back in 2019. Salivary flow measurements should be part of our first dental appointment for adults.
100%.
Yeah. Establishing an individual baseline before the patient even develops a complaint could be the way to go, Ju.
Personalized medicine, right?
Exactly, personalized medicine, this is the word. And it allows us to diagnose salivary dysfunction based on that person, on parameters, instead of relying on these broad heterogeneous values, you know.
Definitely, yeah. No, I'm very happy personally to hear you say this as well. It's exactly what has been crossing my mind also, because like here at ACTA, let's say for the unstimulated whole saliva, we use the cutoff value, usually 0.1 ml per minute. It doesn't work for everyone. It does not. Like, you see so many people who fall below this. They have no issues. They have no complaints, no problems. there is really a need for the personalized part. And yeah, I'm very happy to hear you say that.
Yeah. And Juanita, another thing that the systematic review made us to start discussing is that instead of using one specific value as a cutoff point, we could try scientifically to discuss a confidence interval. Like, for example, in our systematic review, the confidence interval for that average of healthy individuals was 0.6 to 1 ml per minute of unstimulated salivary flow. So maybe instead of having 0.1% less than that is problem, higher than that is not a problem, maybe we can have like a range of what we could consider normal.
No, exactly. And I think, as you also briefly mentioned about like maybe specific to certain conditions, that each condition, like for example, in a certain range, you're more likely to get caries or more likely to develop periodontitis. Like I think that would indeed be an ideal situation. Yeah.
I think the idea of having a range it's interesting because the variability is there. So how can we have a cutoff that is one number when we do have variability in the population? And the population is also changing so much with our habits and everything that we're including in our lifestyle. So having a range would be great. And I think the personalized part, it's hard. What are you going to consider in that? Because the patient is going to go first time, first visit, and then we do a saliva collection and we see what is the normal if the patient doesn't have any complaints yet. And then if they start having complaints or dental caries, then we can analyze that in comparison. I was thinking like that, what is going to be the other things that we can put in the personalization to make it work in a way that is for each patient?
Well, we worked on that with that meta-analysis I mentioned, comparing any kind of hypersalivation associated condition versus healthy. With this calculation, we saw that a loss of 0.4 ml per minute could represent a problem. So I'm not sure if it's helpful at this point for this discussion, but it could be a way to start, you know. So if your patient present a loss of at least 0.4 ml per minute from 1 year to another, maybe you can start screening what could happen in their lives to see what happened there.
Yeah, and maybe also connecting to other organs, right? Do you feel anything in your eye? So if you have this connection with the other specialties, we can make the diagnosis better too.
Since we're like in a Zuckerman gland group, I also have a feeling that considering other groups like pancreas, even like mammary glands, we're a little bit behind on time. So maybe if you can look up what other groups are looking, because I know that in like a optimal world, we're looking for being precision for each patient, but thinking public health, it's important to create some cutoffs and some sets. So not sure if we do have an answer for that, but I think it would be cool if we can check for other groups to see what they're doing around.
Yeah, I think that's actually a very good idea for a future episode, Bruno. We should take notes of it and make sure that we bring someone to discuss this with us. I think one of our last subjects, let's talk about aging and the study related to that population.
I'm very interested in that.
Oh,
It's
yeah,
like
me too.
I do work with aging in salivary glands, but more in the tissues than in the saliva flow itself. And the literature is just there's nothing. When we're looking to tissues, it's very heterogeneous the way that we see the aging in the salivary glands. We have like a fat deposition and a replacement of the parenchyma of the gland. But it's really hard to associate with just aging or with some medication or some systemic disease. So I would love to see if you think there's a specific drop of saliva in aged patients that are not associated with medications.
Yeah, that's a great question because the idea that saliva inevitably declines with aging is everywhere, but often without properly considering other factors that came with aging, like medications and chronic disease, of course. But, Bruno, I would be a terrible scientist if I claimed a causal relationship based only on our cross-sectional data. So to truly prove the direction of this association we showed in our previous data, we need longitudinal evidence. It's fact. We all agree with that. But what we can say so far with our study is that age is indeed associated with salivary flow, even after adjusting our analysis for type 2 diabetes and medication use, suggesting a small decline of about 0.05 ml per minute per year for both unstimulated and stimulated salivary flow. But the big question, what point does this decline become clinically relevant? And that still needs investigations, and we are now working on some longitudinal data for that, together with my PhD student, Joana Silva, the first author of the systematic review we were discussing earlier. We are analyzing data from about 70 individuals longitudinally for a year in machine learning models, and combining all clinical, blood, and salivary parameters to estimate the loss of saliva over a year in those patients. I still cannot say anything about aging. I just can say what happened with saliva over a year. And again, age consistently emerges as one of the variables explaining change in the salivary flow in this study. I like to say that I'm always fighting against sugar, Ju. And another variable affecting this was consumption of carbohydrates and fibers. So diet, aging, and other parameters, blood parameters, and things like that. But this is just a spoiler. The manuscript's not ready yet. We are working on that, and we hope it gets really nice. And we hope we can submit it very soon.
That's cool. So you're seeing that there's like a correlation between not exactly just like systemic, but more with like habit and other external things. More okay. This
A
is
lot of
really
factors. Yeah, in this analysis using machine learning, we added several factors, clinical factors, for example, number of teeth, use of prostheses, bleeding on probing, also blood parameters, for example, glucose levels, triglycerides levels, everything. So different kinds of data combined to try to explain how it happened. And why we did that? Because when we use the conventional statistic methods, for example, a regression method, it's really hard to do that with saliva because, as we said before, it varies a lot. The variation is really big, so it's hard to use. But now with the artificial intelligence tool, I think we can combine much more variables in the same analysis to really together predict something that is real life for our patients,
Cool. Another aspect that also goes towards our group here is that will be pretty cool if we have like a system biology approach to see if other exocrine glands are having the same drop of like secretion during time. I know that's pretty hard. How you're gonna get other fluids? Maybe lacrimal glands it can work well, but in other ones it's pretty complicated. But it's also if there's any correlation. Not sure if you saw this or you guys tried to do this on the paper, but it's something that we consider more like a clean aging of the exocrine system as one system and not as like a isolated organ in the body. And I have a lot of interest on aging, and it's every time it's very hard to find on the literature things that justify that we're having a decrease of the flow rate, and it's not correlated only with medications, but when we're looking to biopsies and surgical pieces in the slide, we see that the parenchyma is changing, even in patients that are like, okay, this patient it's grabbing like a biopsy from a place that was not supposed to get the salivary gland. The patient doesn't have nothing, but then you see that there's a lot of replacement of that. So thank you very much. That was pretty helpful.
And I want to bring the part that you talked about the habits to bring the microorganisms in our mouth. How is this changing the microbiome of our oral mucosa, and how does that affect saliva, or how saliva affect the microbiome? Can you comment on this connection?
That's great. And honestly, my favorite topic, because it's where the oral microbiome truly meets the clinical reality and the translational research, actually, in my opinion, of course. Um, One of the book's chapter, the Symbiosis section, was headed by Dr. Deborah Heller, my dear friend and a former president of the IADR Salivary Research Group. Deborah and her co-authors mentioned it in our chapter, in that chapter, understanding the positive role of saliva in the oral microbiome as a guardian or gatekeeper, as she mentioned this word, of the oral microbial balance can unlock a therapeutic potential of saliva, not for only for oral, but also systemic disease management. I personally think that to advance more and to really connect what changes in saliva can do in the microbiome, I think we have to advance in the oral microbiome field. And I think we have to refine how to study microbial composition, how to study microbial functions, and especially how can we combine all of this with patient level characteristics. As we are discussing before, we have lots of clinical characteristics that could be changing the salivary flow, the salivary composition. So I believe this all should be combined to study how it changed the microbiome. So in the composition level, if I may say, I believe we have to stop studying the dominant bacteria. We already know that. We have to study what the low abundance microorganisms like archaea that we are studying here in Brasília, or viruses, or even fungi, what they are doing. They may be numerically rare, but their ecological impact can be disproportionately large. They can shift the behavior of that community in ways that we may cite the butterfly effect from physics. So to completely understand the salivary microbiome and how changes in saliva would change the microbiome, we must analyze not only the big streptococci composition, but also rare taxa. In terms of functional analysis, I believe we have to look at the health again, instead of looking specifically for disease. For example, how can we maintain the microbial resilience that we already mentioned here, that one of the functions of saliva is to maintain the healthy microbiome resilience. So I think this is a central role that we have to discuss more, what is happening in health, not only in disease. And then at the patient level, this is, as I said before, this is the most important at this point, in my opinion, because a biggest limitation that I can see in many oral microbiome studies is that key factors such as diet, hygiene, medications, systemic disease, hormonal changes, smoking, alcohol use, vaping, denture use, number of teeth, these are poor documented. They are not studied. And not even salivary flow, not even composition of the saliva in terms of some proteins or some key proteins that could be changing the environment. So I believe we need some rich clinical, what we call in microbiology, metadata, that could be combined to interpret microbial patterns clinically meaningful. So now, thinking about saliva within all of this, of course, this is not just a fluid where the microbes float around. It's not like that. It's an active ecological force within the microbiome. So it provides nutrients, neutralizes acids, that is super important for caries. It has proteins and peptides that shape the microbial community and help to maintain this core microbiome associated with health. So this is not just something like a fluid or something like it's not going to impact the microbiome. So this integrative view of microbiology, ecology, salivary diagnostic, it has motivated my research as a whole, you know. For example, I'm always fighting that one of the goals in caries should be not only eliminate microbes, but also understanding how to strengthen their resilience, supporting this stable, healthy ecosystem with a healthy diet, but also with a healthy saliva.
It's also personalized, right? Maybe we're going to have different abundance to different people, and that's going to result in different things. And I think one of the main purpose of this group here, this discussions, is to bring awareness of all these subjects, all these topics, so we can explore more and get more evidence together to make the progress.
So yeah, I think we had a wonderful discussion, and maybe to wrap things up a little bit, looking towards the future. Well, what are your hopes for your research going next, and for the field, and for your next steps in your career in general?
Thanks for this question. Looking ahead, my work is moving more and more toward the population level of saliva research and, of course, microbiome studies. I'm very interested in how broader environmental and demographic factors, things like climate change, regional diversity, and population aging that we discussed before with Bruno, how this can shape the oral microbiome and also salivary function within our mouth, and how can we protect these factors to maintain our patients in health. I think this will open an entirely new dimension in understanding oral ecology in my group, but we still need to find specific funds for big ones. So yeah, I hope I can get it soon. And I'm also committed to expand our studies here at the University of Brasília on low abundance taxa and their functions in the oral microbiome. We have a nice group of students working specifically with archaea, and these must be overlooked across all studies, and they can be some players in caries or other conditions that we cannot see because it's really hard to get them. It's super hard. And for the field more broadly, I want to see stronger clinical studies, Juanita. I want to see studies not isolating variables, but integrating microbiome, diet, behavior, systemic health, salivary biology, everything. And for this, I mentioned before, for this, I believe artificial intelligence will be transformative.
Well, I think that sounds like a wonderful future perspective. It's really nice to see, and I hope you succeed in all those endeavors for sure.
All right, I think we could be discussing science here for hours, but I have to wrap up our discussion. So I want to thank Professor Naile for sharing her research and her experiences. It was a pleasure to have you here. Thank you so much for your time.
Thank you again for the invitation. It was a pleasure to join you representing the saliva research in the Global South. And I look forward to future collaboration and to seeing how this podcast continues and elevates salivary research.
And I also want to thank you, Juanita, for helping us moderating today's episode. It was a pleasure to meet you and to share this moment with you.
Yeah, thank you also so much for the invitation. I had a wonderful discussion with all of you, and it was my pleasure to be here and looking forward to what the future brings.
Thank you, everyone. And if you got to the end with us, thank you for listening. We'll see you again on the January 27th.
For all the listeners, we were also wondering if you are aware of the Saliva Symposium coming in 2026. It will be from the 6th to the 9th of May next year, and we want to cordially invite you all.
Don't forget to like this video and share it with your colleagues. Happy New Year and see you soon. Bye.